be the most important single decision made by government in our lifetimes. And if we don't get involved and let our elected officials know how we feel, we're going to be in deep trouble. We have got to get this right the first time. I'm old enough to remember when we put the first CAT scan machine in at MCB. That was 1976. The brand name on that CAT scan machine was EMI, Electronic Musical Instrumentation. The story behind that is that the Beatles were incredibly successful selling records in America. And they took that money to London and they used venture capital. They gave it to a physicist who hooked a computer to an X-ray machine, and that's what CAT scan is. So if the Beatles hadn't been successful, if you hadn't bought those records, we might not have had CAT scan machines as soon as we did. But the lesson there is that this is entrepreneurial. This is business, entrepreneurial, technology, and healthcare. And one of the real fears here is that we will lose all of that if we go to the government model. Now, don't get me wrong. I do think we need some reforms. We have got curves now and costs that are not sustainable. And we've got to do something. We don't need to turn this whole system upside down and put in a completely new parallel government-run system controlled by us. Now, to make matters worse, Washington is not using any of the lessons that we have already learned from states around the country. Tennessee, some years ago, put in a program called TennCare, and it went bankrupt. The state of Maine put in a program called Dirigo. Dirigo is Latin for I lead. It's the state motto. And Dirigo, healthcare in Maine is going broke. 3 years ago, Massachusetts put in their employer and individual mandate. And yes, they managed to cover a portion of their uninsured, but they have shot expenses through the roof and run into major access problems for the citizens. So now what does our federal government want to do? They want to institute exactly the same kinds of failed reforms, only on a grander scale. I don't get it. You know, we have a long tradition in this country of caring for our sick and our needy. Virginia has 56 free clinics where care is delivered for free to citizens all over the state. We know many churches, we know many nonprofits that do this as part of their mission. And many churches have parish nurse programs. What's going to happen to these folks and to their mission when everybody gets government care right off the bat? You know, in my business, I hear stories every day about people coming to the United States to get health care. Now, yes, we get the sheiks from Saudi Arabia who go to the Mayo Clinic, but I'll tell you a story I heard just yesterday from a physician. An indigent patient, a poor person from Africa, lands at Richmond Airport in congestive heart failure. Heart's not pumping, lungs are filling up with fluid. That person, as soon as they land, are put in an ambulance and brought to a hospital in Richmond and get the care that they would never have gotten in their home country. And we see this happen every day. We may need to expand the safety net some, but you can't deal with this group of people with a sledgehammer. We need to put reforms in place that are designed to try to get those folks who decided to not buy insurance to go ahead and buy health insurance. If we can do insurance products that will be better tailored to those folks and that are maybe a little bit less expensive, I think we'll see that the people who've chosen to not buy health insurance will go ahead and buy some health insurance. You know, one thing that's not at the table in any of this debate is the cost of malpractice insurance and tort reform, and I think I know why it's not at the table. But here's the problem. Nobody really knows what the cost of defensive medicine is. But one thing is for sure, it's a big part of it. It's a big part of the cost. We have an opportunity to create a system that might actually compensate folks for bad outcomes, get rid of the cost of defensive medicine, allow suits for gross negligence. You operate on the wrong body part, that's a no-no, and you should be punished for that. But the system would put incentives in place to improve quality. It might be structured not unlike a workers' comp system is. And these kind of things have been in place in countries around the world, and they work well. So there's a challenge where we can actually do some tort reform, legal reform, and link it to quality and make the system better. Let's just step back and let's think about maybe 2 or 3 basic principles, things that we really think might be important to talk to our elected officials and our neighbors about. Principle number 1, decisions about your health care should be made close to home by those receiving the care, their families, and those providing the care. That's really important. And this is the nub of the argument. It's all about control. It's all about who's going to be making those decisions. Will the government be the decider, or it will be the people using the care, delivering the care, and paying for the care? This controversy we've just had over the end-of-life provisions, what is it, Section 1233, I think is very telling. While it may have been voluntary, it's been dropped from one Senate version, it still prescribes, it still directs you and me what will be said in that conversation. Surely this is a conversation that should be held in private with the patient, the family, and the doctor, with no federal obligations on what should or shouldn't be discussed. That kind of bureaucratic thinking is a great example of why you need to be engaged now on this issue of talking to your families. Principle number 2, simplify health insurance and let's provide some transparency. One of the reasons why health care is so expensive is that we rarely don't know what things cost. We have a complicated system. Now, I'm not bashing insurance companies. We need insurance companies in health care, but we need a vigorous market in companies where people have more choices. Government's probably played some role in making things as complicated as there are. It's now an opportunity for us to help make things simple. Number 3, and I'm almost done, this is market, using economics, market forces and market-based economics to bring things under control. If the employee had the dollars rather than this insurance, if they had the money, they could pick an insurance company that was responsive to their needs. I'm going to a wedding tonight of a young lady who came to Richmond, and she's getting married, and she got a great job. She got a job with a law firm, and they had employer-based coverage, and she was given a choice of 3 plans. Now, what insurance company? 3 plans, paid for by, actually it's paid for by her, wasn't it? It's a part of her salary, but people don't realize that. Well, each one of these plans had something in it that she would never have wanted, would never have bought, and yet she has no choice of what to do with that. She's got to pick one of those 3 plans. If she had been given those dollars, she could have shopped for an insurance plan that was tailored for her. Then she would have been in control of the dollars and the plan, and if the insurance company wasn't responsive, she could have switched. Now, we've got some other things we need to do too. We need basic reforms in the system, like allowing policies to be sold across state lines. That's the case with all the kinds of insurance that I know about. It would help the small businessman, because then they could pool, they could put their employees together. You could buy Kiwanis Club insurance, you could buy Lions Club insurance, but then you'd have a big enough pool that it would help the ratings. We need policies that aren't loaded with mandates. We need to prohibit cherry picking, require pre-existing conditions to be covered, and guarantee portability. We need to nurture the HSAs and the high deductibles because they actually work for a lot of people. We don't need more health commissioners, health czars, health committees, and decisions made in Washington. We need more transparency, and we need some good basic economics into this.